Medical treatments are constantly evolving and local doctors are ahead of the curve when it comes to technology and procedures. Dr. Louis Obie and Dr. David Heekin are two of the four specialists that make up the Cells Surgical Network of Florida, as you can see them there. And we want to welcome to the shows Dr. Obie and Dr. Heekin. Thank you both for taking time out of your busy schedules to join us. And Dr. Obie, what is the Cells Surgical Network? How did it evolve?
Cells Surgical Network is a group of physicians from all specialties that are coming together to study the benefits of stem cells in human medicine. It actually evolved from the California Stem Cell Treatment Center, founded by Dr. Lander and also Dr. Berman in California. Coincidentally, I met Dr. Berman while lecturing at international symposiums on different areas that we share.
Well, and let's talk about how stem cells are being used in your area of expertise in plastic surgery, and then Dr. Heekin will talk to you about how stem cells are being incorporated in orthopedics. But first, how are stem cells being used?
Unknowingly, 25, 30 years ago, I was using stem cells in my patients by injecting their own fat. More recently, we discovered fat is the best source of stem cells, and primarily I use stem cells in plastic surgery for facelifts, for three-dimensional expansion of the face.
As we're looking at the pictures on the screen.
This is all from stem cells, and also we use it in the breast, hands, and buttocks and other areas.
And Dr. Heekin, then, how are stem cells used in the field of orthopedics?
Well, stem cells are undifferentiated cells. They're very young cells, and they're repair cells, basically. And we've known about them for a long time, but really have never harnessed them until recently. And now we inject them, we purify them, inject them into joints, and they seem to make the cartilage a lot stronger and sort of reverse some of the wear and tear that we've seen, and oftentimes result in great clinical results.
And we've heard of, maybe people in the audience have heard about stem cells being extracted from bone marrow, but this is different. We're talking about stem cells being extracted from fat. So talk about the difference between those two.
Two main sources of stem cells are from fat and bone marrow. Fat stem cells are higher in numbers, much more viable, and also much easier to harvest. It's really the state of the art for stem cell therapies in human medicine.
So how do we then produce stem cells in our fat? How is this even possible that our bodies are doing this?
We're born with a tremendous number of stem cells. As they diminish in numbers, we age. Fat, superficial fat is the best storage area. Fat contains up to 2,000 times more stem cells than bone marrow. And again, these are cells that replicate and they regenerate tissues.
And I think a lot of people, keep going, yeah.
Yeah, and fat's the best source. And again, through our specialized procedure of purification and concentration, we can end up with millions of stem cells versus 50,000 from bone marrow. And they're viable throughout our lifetime.
And it's incredible when you see the results earlier in the pictures with one of your patients. It was a total transformation, and you talk about the need of not having surgery as a result of having stem cells injected into joints. How does the Cell Surgical Network then track the safety and efficiency then of the stem cell work? How do you do this?
We started with 5 members. We're up to over 100 members internationally. We have a common database that we feed our data into, and we track patients every 3 months for 2 years, and we use pain management scales or pain scales and also functionality scales as well as imaging before and after treatment. And Dr. Heekin can shed more light on the tracking.
Sure, yeah.
And so we would like to objectively be able to say that there is a marked improvement. Subjectively, we can demonstrate that with the ratings, and objectively with imaging studies like MRIs.
Yeah, what about safety? I mean, I'm sure a lot of people might be thinking to themselves, is this something that is safe for me to do?
Well, to date, we have 1,000 patients in our database with no serious complications. Efficacy is being established also with the pain scales, functionality scales, and imaging, as Dr. Heekin had mentioned.
Yeah, very quickly, who is a candidate for something like this, if they either from the orthopedic side or the plastic surgery?
Plastic surgery side, all procedures we perform in plastic surgery may be benefited with stem cells. In the orthopedic side, I'm going to let, again, Dr. Heekin.
Well, I think orthopedically it's available to patients who would like to see some improvement, who aren't ready to put metal and plastic in their joints, and I think it's a great option for them.
Yeah, well, very quickly, we're running out of time, but you have a symposium coming up that's primarily for healthcare providers and also for physicians. Talk about that.
Yes, it's the first ever in Jacksonville for a stem cell symposium. It's being held at Memorial Hospital on the 16th of October. And in the morning, we'll have a hands-on demo at my clinic. It is going to be the first of its kind in Jacksonville. We're very excited.
All right. Well, Dr. Obi,
Thank
Dr.
you. Thank
Heekin,
you.
good to see you. Thank you so much for
Thank
coming
you.
and
Thank
sharing.
you.
And we'd like to thank the Cell Surgical Network of Florida for sponsoring this segment. You can learn more by visiting stemcellsurgeryflorida.com. The group will host its first ever symposium on October the 16th. It is free, but primarily for the physicians and the healthcare providers. And you can get more information by signing up with the website link there on your screen.